Hi everyone, so this is Dr. Justin here, and welcome to an episode of Before and Beyond. So it's a new series that we have just created, and basically it's to actually talk about our treatment philosophies to our patients. And one of the biggest reasons why that is important is because often, our patients don't really understand why we are doing it, and often we have to explain a lot to them. And at the same time as well, because they get really nerve wracking over there, it's really hard for us to actually sometimes explain to all these concepts to them. It's important that we actually sit down together and we can really go through what we actually think about. All right, so today's episode would be more about smile analysis. Okay. And so it's a bit of an occupational hazard nowadays where we're looking at people's smile, and I would always look at ways to improve it and see how whether we can or whether the smile is nice or not, and from there we can then self-improve as a dentist to find out how can we get the best smile that the patient can have. All right, so let's just go with a few cases and then we can talk about it as well. So the first case is a very, 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 very difficult case that we are looking at. Okay, and unfortunately, in Singapore, I won't be able to show you before and afters, but I think it's important that we know how we are planning our cases, our treatment. And so this patient comes from Indonesia, and you can see that. So she flies in and out to see us. And you can see that it's very, very difficult to treat her case, and her concern is, number one, she wants to have a nice looking smile. She wants a whiter set of teeth. She wants straighter teeth. She has been in on braces for the last 5 to 7 years, so it's a long time. The average treatment duration for braces is about 2 years, so she's way past that amount of time already. So we know that she is wanting to get something done well and done relatively in a quicker time, right? She has had a history of what we call tetracycline staining, and basically what that means is that when she was young, she had the doctor gave her some antibiotics called tetracycline. It's a family of antibiotics that has that during the development of her teeth, that antibiotics actually gets incorporated into the structure of the teeth itself, that then stains the teeth in this very, very distinctive color that is brownish color that you don't really get on natural regular teeth. Okay, so she doesn't like that, obviously, and she wants to fix that. Okay, so what we're trying to look at is that we're trying to look at whether the teeth. So in every smile analysis that we are looking for, we look at the midline. So let's imagine the midline is going here. All right. So you can see that it's pretty coincidental with the teeth. And then we look at her arch. So you can see over here that the arch goes. Let me just change another color. So we look at her arch, right? So you can see that what I'm trying to do is I'm trying to find out whether it's harmonious with her lips. So the border of the teeth, on the edges of the teeth over here, needs to flow and be parallel to the lip shape. All right, so you can see that the blue line and the yellow line are pretty much quite parallel to each other, so we don't really need to change a lot on how her teeth are aligned from a vertical axis. Now we then look at the width of the teeth, and so that's a bit more difficult because you can see that clearly the teeth are not in a good size. One is a lot more bigger than the other one. This is smaller, this one is smaller, this one is bigger. All right, And so we need to obviously fix that. So first of all, what we do is from the midline, we draw our natural set of teeth. So we can see that the edge over here is correct. So now we can just draw our set of teeth. And then from here we just go same width. Like that. Okay. Sorry, I'm gonna just change that a bit. We're gonna go here to here. So this is the correct size. This is too big, right? So you can see that this is. So how we can judge that is that over here, this part here is too wide, right? This part here is too wide. So when we are designing the smile, we want to make sure that the two front teeth are symmetrical, and clearly they are not. So how we can do that is by looking at it in a very, very easy way, is by looking at the proportion of teeth. So if we have a look at this proportion, let me just delete this, it's too much stuff. Imagine her midline is where we want it to be, the same midline as where we want it to be. Then this teeth over here, the edge is where we want it to be, and this is the edge we want it to be. Okay? Alright? The proportion, and this tooth is most likely over here. After you reflect, once you remove the lips, that's around there. So this is supposed to be, a good proportion would be from 80, so it's from 80 to 95%. What I mean by that is that if you take this measure, which is the width of the tooth, let's say we put it as X, and we put it here, the length, we put it as Y, okay? So, I know it's tough, but X of, let's just change color again, X over Y times by 100 needs to be 80% to 95%. 95% is already stretching it, but 80% would be the great idea. What I mean by that is that if the proportion of the tooth is 80% for the central incisors, the two front teeth, if they're 80%, what it means is that the width is 80% of the length. So that ends up being very aesthetically pleasing. If, for instance, this scenario where the tooth over here is wider than the length over here, this is more than 100%, right? And if it's more than 100%, 100% is a square, right? Because it means that you have, like, for example, you have 10 mm over 10 mm is a square. But if it's more than 100%, means that the width of the tooth is longer than the length of the tooth, okay? And that's not pleasing. How we can create a nice proportional tooth is that we look at those proportions, look at this percentage, and we lengthen the teeth on the edge or on the gum itself. Okay, so from there we are able to then build. From there we are able to build this based on the proportion of the two front teeth. Okay, so that's how we create the smile. So that is one way we should do it. So let me just cancel all this. It's too much stuff. So that's the first thing we want to do. The second thing we want to do is that she has braces. And so the first step when we are going to do this treatment is we are going to remove her braces, because braces are in the way and she doesn't want to wear braces anymore. And she just wants to go towards doing a more restorative approach. What I mean by restorative approach means that she would like to do veneers or crowns to help to fix her teeth. And so with that, we are looking at removing the braces, cleaning up the area, doing a scan, and designing a smile based on her natural teeth. And from there, we'll then be looking at removing some tooth structure, reshaping the area for us to expose the tooth a bit more, so that we can then reposition the teeth based on where the bite should be and where her smile should be. Okay. What else do I need to say? Yeah, I'm cool. So now I really finished the case, and she's really happy, and she likes the smile a lot. And the challenging part for her case was to have the good realignment of her smile, but at the same time, the staining of the teeth, because they have said tetracycline staining, is really, really dark. Therefore, we had to make sure that we use the correct mixture of porcelain to be able to mask the color of her tetracycline, but at the same time, when we mask the color of the tetracycline stains, the issue is that it becomes too opaque. So we need to have a different mix of porcelain to be able to give it back the translucency and the natural characteristics of the teeth. So that is a bit more difficult, but we managed to achieve a relatively great results from there. So we're gonna go on. So this is another patient of ours, and so she's a very, very friendly patient, and she's a friend of mine now, and basically she was complaining of really buck tooth on her two front teeth, and she has had multiple issues with her teeth breaking and having tooth decay there, and she has seen the dentist many times because there was a lot of fillings that need to be replaced and subsequently replaced all the time. And she came to us saying that, hey, I really want to improve my smile, but not only that, she wants to also put an end to doing multiple fillings every time, because every time she goes to the dentist for something small, they will say, hey, I need to redo the filling, I need to do a new filling for you. And so she was really quite saddened by it, and she wants to get a proper permanent fix to all these things. So in her case, because of the damage of her natural teeth already, we opted to do some crowns for her. But let's analyze the smile together. So you can see over here that, number one, the width of the teeth are not correct. You can see that one is bigger than the other one. This is bigger, this is smaller than the other one. And then you can also notice that the two front teeth over here are a lot more forward than the back teeth, right? And so what happens is that if the back teeth are a lot more pushed back, the front teeth are two front teeth are more forward. This creates the illusion that the two front teeth are bigger than they actually are, because they are a lot more closer to someone looking at you, at the patient. And so this gives the illusion that you have buck teeth, right? Because it's just two front teeth bigger than the rest. And it's not really due to the fact that the teeth are bigger, but it's just because of the position of those teeth. And so what we can try to do is we can try to actually go and either, there's two ways we can deal with it. One is we can push back those two front teeth by doing braces or Invisalign. All right, push them back, or we make the other teeth, other than these two front teeth, more forward to make it in line with the two front teeth. This can also be done with veneers or crowns, where we reshape the teeth in the two front teeth to be more backwards, and then we bulk up the rest of the teeth to be more forward, to be in line. Usually we do a combination for crowns and veneers. We usually do a combination of movements. What I mean by that is that we don't trim the two front teeth all the way back, and keep it to the same plane as the other teeth. But we usually bulk the teeth as well as push back the teeth as well, so that we don't need to shape so much of your teeth. All right. And so if you have a look over here, she has. It's quite interesting. So you can see that her alignment of teeth is like that. One is like that. One is like that. And one is like that. And one is like that. So you can see that what we call the long axis of the tooth is everywhere. Okay. And so in a natural smile, you want to have all the teeth going the same plane. Going the same plane, going the same plane. Going the same plane, going the same plane, going the same plane, pushing this out a bit, out a bit. So that way it looks more harmonious. So the thing that we're looking at is the direction of the teeth where it's facing should be in harmony with the neighboring teeth. Currently it's not, because some of them is facing inside, some of them is facing outside, some of them is facing straight. So you want to obviously fix those things. Okay, then we look at the lip, harmony with the lip. So you look at over here and see whether it's in line. Okay, and you can see that it's more or less in line, but you can see that the distance between the two front teeth and the back teeth is a lot more. The difference is quite a bit. You can see that over here it lines up well. That's a nice line here. You can see that it lines up well here. All right. And then when it comes to the two front teeth, it's sort of too long. All right. So either we lengthen each tooth, either we lengthen each teeth slightly lower to make the difference of the two front teeth, the length of the two front teeth not so prominent, or we trim this part here and reshape this part here, or move these teeth upwards to be able to be in line with that yellow line or that bluish line. All right. So that way we can help with that. Other than that, I don't really see much of an issue. It was quite a straightforward case. You will also notice that when she's smiling, a lot of people always ask me how many teeth should I do, how many veneers should I do, how many crowns should I do, and the biggest answer is that in her we had to do at least 8, because in her case she wanted to have a nice color change between. Have a nice color change, so she wants to have a much more whiter teeth, and so if we just did 2, it will just look weird because it will just be 2 white teeth and it looks like a bunny. So we had to do a lot more, and so because she's displaying at least 8 teeth, we need to do at least 8 teeth to get a nice color change, but at the same time make it not obvious. But if her concern, which is not her concern, but if her concern is that she wants a wider smile, she said that, hey, when I'm smiling, I only can see my front 8 teeth. I can't really see this at the back because I can see only a shadow at the back over here. That's when we have to include more teeth, because you can see that over here, the teeth is very small at the back over here, and it's very inside. So this is called a buccal corridor. So I can write it for you. It's called a buccal corridor. All right. And if it's a really wide buccal corridor, means you have a narrow smile. If a smaller buccal corridor means that you have a bigger smile. And for example, Julia Roberts has a very small buccal corridor and she has a really wide smile. You can see up to her molars, right? And so if her concern was that, hey, I really want to have a wider smile when I smile, I want to show more teeth, then we need to include more number of veneers or crowns to increase the volume increase the number of teeth that are being seen when they're smiling. So in her case, then I would say, hey, we got to think about doing an additional veneer over here to get it where we want to be. Over here as well, to get it where we want to be in the same color. All right, so that way we have a better, broader smile. All right, sorry, I'm just gonna just draw it nicely. Understand it? Should be in line with the natural teeth, which is like that. And over here, it should be in line with this, like that. Okay, so then we have a nicer, broader smile that also fits along that smile curve. Okay, so great. And then the last one I'm going to show today would be this patient over here, where you can see that he came to us saying that he's showing too much gums. He's showing too much gums, and he doesn't like his smile because it's a bit chipped. Okay, in this case, he was not so concerned about the chip area, but she was concerned about the fact that he shows a bit too much gums and his teeth was looking small. All right, he's quite, as you can imagine from this picture, he's quite a buff guy, quite a strong guy, and then when he smiles, he shows like small teeth, and it doesn't look very masculine. So he wants to show more teeth, and longer teeth and bigger teeth. All right, and so remember, I just spoke to you guys about the width of the teeth. So you can see over here that the width of the teeth over here to here, this is X, and then if you go here and here, then that's Y. This X is around Y. That means it looks like a square, right? And in order for us to achieve that 80% rule, how we need to do it is we either lengthen the tooth here to reach 80%, or we lengthen the tooth gum-wise %. And I mean, this is a very clear indication of what we should do. Number one, we shouldn't choose the yellow one, because if we lengthen the tooth edge-wise, what that means is that we need to lengthen all the other teeth as well, and it's not possible. It's possible, but it's not nice. At the same time as well, it'll overlap the lower teeth a lot more and cause more destruction on that edge already. And you can see as well that because of how deep his bite is already, he's already having some chips onto his natural teeth. Can you see that there? He's already having some chips on the natural teeth. And if I'm going to make the teeth longer edge-wise, there's going to be even more chip on the edge. So the best idea would be to actually lengthen his teeth gum-wise. So what I mean by gum-wise is that we have to trim the gums. This can be done using a scalpel. This can be done using a laser, and we use a laser in our clinic. And the procedure is very, very quick and relatively painless, and the recovery is fast. But what it essentially does, it basically uses a high concentration of laser that has a lot of cooling agents. So in this case, it's water and air. That when we remove the gums using the laser, it cools down as it cuts. What happens is that it's a very clean cut, and the body is able to repair itself very, very quickly, as opposed to using a knife or using the conventional lasers, which is basically using thermal to cut, like using heat to cut the gums, because with heat you tend to damage the gums. But the laser, the laser that we are using has water cooling agents to really cool down the cutting so that the recovery is a lot more faster. So in this case, we're trying to think about removing the gums to actually help with this patient. Now, we can't just cut one tooth, all right? Because if we cut one tooth, this will be 80%. If I cut this tooth, and this will be 80%. But the rest is going to be 100%. This is going to be 100%. This is going to be 100%. This is going to be 100%. And it doesn't make sense, right? And suddenly that patient is going to say, hey, I have this tooth that looks bigger than the other teeth. What should I do? So usually in this kind of cases, we have to cut a number of gums, of teeth, because then you create a nice harmony in terms of aesthetics. So how it looks like. So let's just go. Let me just draw an outline for you. Pardon my drawing, guys. But essentially, what we want to try to do is we want to try to trim the gums so that it goes from here and be same in line with the gums over here. The shape of the gums needs to be the same as well. Okay, so as you can see, it's mostly the same already. Maybe I can just edit this part a bit. Yeah. Okay, so that's done. And then over here, we will lengthen the gums over here as well. Just a bit over here. And over here, we'll just lengthen a bit over here as well. So over here, same thing. We want to be in line with the neighboring tooth. I mean, not the neighboring tooth, but the tooth on the what we call a contralateral tooth. Essentially means that this tooth over here, right? So you want to be the same mirror image. So you want to see that you want to trim the gums over here, so that it's a lot more in harmony with the teeth. All right. So that way if we can just do a regular gum trimming, what we call a crown lengthening procedure, I think the patient is going to be very happy. He doesn't need to spend a lot of money to do other treatments like crowns or veneers. It's just a matter of just doing some crown lengthening to actually help with the smile. Okay, so that's how we think, and that's how we actually go about with our smile analysis, and it's actually to do with a lot with numbers. So you can see that in my head, whenever I look at the teeth, I'm looking at formulas, like mathematical formulas. I'm looking at whether is there a ratio, is the ratio proportionate, is it proportionate to the natural teeth, and how it can actually help with us planning the smile. And so it's based on a number of reference points and based on a number of formulas that we use, so that we are able to develop a treatment plan that is suitable for your face, but at the same time follows nature's rules. Okay, I think that's really important. I think that's all for me for us today. So I'll see you guys next time for our next episode of Before and Beyond. And if you guys have any sort of topics that you want me to discuss, I'm happy to. Please just let us know. You can leave a comment below, and we'll get back to you guys. Thank you so much.